for those of you who don't know, I'm Adam Giancarlo, LCSWR. I am part of the Problem Gambling Resource Network, and I am currently in private practice. I've been in the field since 2009. I began doing work with children in a domestic violence shelter, being the children program coordinator there, and I incorporated feedback-informed treatment from the very beginning of my career, including my internship, my first year internship in grad school. I was exposed to it and learned all about it. So I've incorporated it into every clinical situation that I've been in as far as different jobs. I've worked in agencies and now in private practice. So one of the great things about feedback-informed treatment is it's pan-theoretical. So it doesn't really matter where your background is as far as, what approaches or methods you use. You can use it with any client population. So those of you who weren't here, I will send you the slides from last training and also the scales as well. So Rachel, if you could just let me know their emails when you get a chance, that would be great. And I'm going to share my screen here. Okay, so last week we talked about who, what, where, when, why, and how of feedback-informed treatment. And today we are going to be focusing on implementation, integration, and best practices. So really what I would like to do is sort of have a bit of an open forum at times to kind of collaborate and discuss ways of implementing this in our regular practice. And it's great that at least Lewis was saying like he has tried some of the concepts and incorporated some of the concepts and what not into sessions already since last training. So I want to sort of work with you to decipher the best ways to integrate this and implement this in your treatment, depending on what context you're in, because I know we're in different contexts. We're in agencies, we're in private practice. Some of us are in administration as well, and we work with all different client populations. So we're working with young people, we're working with older people, and so I'm going to try to sort of cater to each of the different types of situations that you guys are in. But the one thing that is holding us all together is the Problem Gambling Resource Center, the New York Council on Problem Gambling. So I will focus quite a bit on that population, the problem gambling population as well. So this is my information. I'm located in Amherst, New York. It's part of the Western New York region. And I will be sending the slides so you can all have my contact information, phone, fax, email. So again, Rachel, when you get a chance, if you can send me I've got everybody's except for the couple that weren't here. So I will send those. So a brief description of today's training is that it's going to build on the basic knowledge and understanding that we gained in the first training. So if we've attempted to implement at least some of the facets of FIT into our practice since the first training, we're going to be invited to share about our experience. But then also at this point, I'm assuming that we have questions in regard to obstacles and barriers to effective and efficient implementation and integration of this approach. So I'll address these issues, discuss the best ways to overcome them realistically and practically, and we'll get into some different case scenarios, some case discussions, and we will also discuss more about what you're likely to expect moving forward in the process of implementation and integration of FIT. So I mentioned last time there are different levels of involvement when it comes to feedback-informed treatment. And at the very least, what I'm hoping that each one of you will get out of this is the idea of creating a culture of feedback within your practice. Again, depending on the context, whatever the context is, but building a connection with your client, working on the therapeutic relationship and alliance, and then helping them to grow, develop, and improve in their lives. And then also, as we move forward, we're going to be talking about deliberate practice, which is for clinicians to help grow, develop, and improve their practice. So, and also to gauge and assess where we're at as far as outcomes and progress goes, and satisfaction with services. So the learning objectives are that you'll have a more in-depth understanding of the process of implementing FIT and integrating FIT into your practice. So you'll have clear and useful solutions to your implementation and integration problems, concerns, and issues. And you'll know what to expect moving forward regarding your continued implementation and integration of FIT. So I forgot to mention, if anybody has questions, comments, concerns, issues, problems during the training, I don't think I can see hands raised, so just interject, be, assertive and just say, hey, Adam, I have a question, or, get my attention and whatnot. And because I want this to be participatory, I want everybody to get involved. So it'll be more of a discussion at points, but beginning with the first discussion, and that's on the implementation and integration of FIT since last week, even though I know it's a short period of time. I'm wondering if any of us have been able to utilize it since last week. So, and then the questions for those of us who have are, what populations have we attempted it with? What were the clinical situations? Maybe give a brief case description. How did it go? And then to what extent did you implement or integrate, and what were the results? And then if we haven't, have we considered it? And is there anything in particular that's prevented us from beginning to utilize it in our sessions with clients? Any obstacles, barriers, so forth. So anyone care to share on either of these questions here? Like Lewis, I know you were saying you have incorporated some.
Yes, thank you so much. Actually, I'll start off. I'll open up the floor. Yeah, so I started to implement it at the end of sessions. Typically, most of my caseload is mental health and some substance use, and I do have PGRC clients as well. And so I wanted to get an understanding of how the session went. So it was more like an SRS type of FIT approach. So I asked him on a scale of 1 to 10, how would you rate the session? What did you like about it? The person gave me a 7. I was like, oh, 7 is a good number, and we talked about it a little bit. And how can we bump you up to the next number? So the person says to me, well, that my problem is resolved entirely. I was like, oh, okay. So we got we have some work to do in order to get there. And then sort of talked about that. So that was basically my experience. I had used other questions as well in other cases. So it's been really useful. It allows for the patients for them to be able to sort of provide some feedback and give us some more areas to work on. So I really like it.
Wonderful. Thank you, Louis. And yeah, I would say that's awesome. Everything that you've incorporated, and sounds like your clients are responding to it. And I would even say you could take it one step further when he asked the question, when the problem, something about the problem being entirely solved or whatnot, you could even ask some goal-oriented questions like, what will that look like? Can you sort of paint a picture for me? What's the image, or can you create a vision of what life will be like when that's going on, and sort of a solution-focused kind of picture. And what will we need to do to get there? What are some of the steps in between from now to then? And then we've got some treatment planning there. Basically, we've got, goals, objectives we're working towards and whatnot, and they're tangible, they're measurable. And so that's one of the great things that we can do when it comes to that. Thank you. Any other on either of these questions?
Hi, Stephanie. So I've actually, I haven't done it, but I've been thinking about utilizing something like this with my staff that I supervise, just kind of checking in with them around like supervision. I always do check-ins with like my clients at the end of each session, and it definitely had some benefits for sure. And I'm looking into starting to use the form as well.
Great. And another great thing about FIT is that there is a scale for supervision. I don't know if you noticed, but in the attachment that I sent with the scales, it includes not only the outcome rating scale and session rating scale for adolescents and adults. It's got the child outcome rating scale and child session rating scale for school-age children, the young child ORS and SRS, and it's also got, I think it's got a group session rating scale, and it's also got the Leads Alliance supervision scale. So it's a scale about how your supervision went. So you can actually utilize the scale itself, and even just the questions on the scale. So let me see if I can actually bring it up here. Let's see here. I am not the most tech savvy person, so can somebody help me with how I get back to sharing other windows on my Zoom?
Yeah, you'll probably need to stop sharing this.
Oh, I've got to stop sharing. Okay. So, all right. So here is what I sent, one of the attachments that I sent along with the slides from last time. at the bottom here is the leads alliance in supervision scale. So this supervision session was focused or not. And then my supervisor and I understood each other in this session or not. And then this supervision session was helpful to me. So it's the same idea as far as the 10 centimeter 0 to 10 point system and everything as the other scales, but it's for supervision. So, and we're going to talk more about that in a future, the 4th training, because it will be focusing on supervision and clinical development. So in different contexts. So get back to that. Okay, anyone else as far as attempting to utilize FIT since last week, or any barriers or things that have possibly gotten in the way?
Well, I didn't see barriers, but I did appreciate that you sent the scales. And similarly, I supervise graduate students in social work school, as well as some limited permits from a clinic. And I found that supervision form is helpful. I would only add some things that are on some of the other scales, like what was the best thing we talked about, and where would you like to begin next time? Because I think even though I have like an agenda and I ask them to bring an agenda, I found that that's really so more specific than what I would have been asking. And I thought that would be pretty helpful to me and to the student or the limited permit. So I like that. And I thought that I would probably, like I said, I'd probably expand it a little bit, but I would definitely use that.
Great, yeah. And thank you. And on the personal variation of the SRS, there are those questions that I think that's what you're referring to. But yeah, you can adapt these scales in any way, that's useful to you. And, these open-ended questions, really the scales are just a catalyst, just a jumping board to, create a conversation, a clinical conversation, a therapeutic discussion, and with a client and or a supervisee. So great, thank you for that. Any other thoughts about any attempts to use it, or anything that might be holding us back, other than those of us who weren't here last week, obviously?
Adam, I haven't provided any kind of treatment or supervision, but
Mhm.
as a person who is supervised and works with people, I have been trying to give feedback to people in the spirit of this, because I think that's important for everybody, and to not only know how to receive feedback, but to give feedback as well. So because this has been on my mind, I'm like, oh, I really liked how that person did that. I want to give some positive reinforcement here and tell them that so he can repeat.
Yeah, great. Yeah. Whenever I'm on a call with, say, an insurance provider or something like that, with a customer service representative or a provider relations representative, or those kinds of things, like, and they're particularly helpful, I always say, hey, at the end of the call, they say, you do the survey and this and that, but like, I would like to let your supervisor know how helpful you were and what you did to actually, assist me to get to where I was trying to get to. And I appreciate it, and, those kinds of things or whatnot. But yeah, so good, bad, or indifferent, getting the feedback and is helpful, and trying to incorporate it is useful. So any other thoughts about attempting to utilize FIT since last week? Okay. Well, thanks everybody for your input. So we're going to talk a little bit about the justification for the outcome rating scale at the intake session. So I talked about it last week that at intake, the way that I introduce the scales is, it's sort of like a little kind of script, but you can do it however, whatever is comfortable for you. But the way that I explain it is, at first I say, I'm interested in tracking the outcomes of my clients in different life areas as they progress through therapy. I'd like to try to make sure that things are generally improving over time as we continue to work together. If things aren't improving, I'm interested in trying to discover what's preventing improvement and determining together what our best response could be. So at the beginning of each session, I will use this scale called the outcome rating scale to rate things. So that's how I sort of explain it to people at the very first session. It's one of the very first things that I do, other than talking about things like confidentiality, privacy, and those types of things, and sort of getting a picture of their some of their possible past experiences with therapy and treatment. But and then obviously getting to presenting problem. But that is, so I'm going to ask somebody to volunteer to, this is going to be sort of like an open forum where you can either use the script, adjust the script, or sort of explain how you might explain it to a client at intake. So anybody want to volunteer as far as trying an explanation as far as the scale goes?
Okay, I'll give it a try. Just to make sure I'm fully understanding, are you asking for like a script to introduce FIT into the service?
Mm-hmm.
Okay. I guess I can start off with something, the way your progress is important to me. And I want to make sure that the service that I'm providing are helping you achieve your goals. So one of the things that we can do to monitor that is to incorporate FIT into the services. And we're going to start off every session by trying this, and then we'll talk about it and see where it takes us.
Great. Yeah, sounds perfect. I would love to hear that walking into a therapist's office on the first day. Those words would be like music to my ears. I would be like, okay, great. Yes, this guy, I might stick with this guy. Any other ways that people think they might explain it, or sort of introduce it to clients at intake?
I don't think I'm as well spoken as Lewis, but I always think he explains things in a really nice way. But I would say something like, as as a part of our sessions, I would like to introduce you to this method where you rate your sessions. And the reason we do this is once we can track progress and see like when and if you are making progress towards the goals that you've set for yourself, and also to help us communicate as client and clinician together.
Great. Yes. Yeah. Communication, opening up a dialogue, creating a culture of feedback and openness, and also charting progress and outcomes and achieving goals, working towards achieving goals. Wonderful. And I loved that, Louis, you used the word important. That's one thing that I think I need to add in here, because I do say that quite often. But yes, that's, because it is important. It's important to me, your progress, your development, your growth, and for you to achieve what you're looking to achieve, that's important to me. So this is one way that we try to see that we are achieving what we're setting out to achieve. Any other thoughts about how they might introduce the scale, the outcome rating scale at the very first session? Pretty much it's going to be in the first maybe 5-10 minutes of the session for best practices. Okay, so then once we have introduced the reasoning for the scale, which for those of us who are unfamiliar with it, it looks like this. So those of us who weren't here last week, this is called the outcome rating scale. And it's used with adolescents and adults. And it's to gauge where people are at in different life areas. So there's individually, personal well-being, interpersonally, family, close relationships, socially, work, school, and friendships, and then overall general sense of well-being. It's a 10 centimeter continuum line, basically from 0 to 10. Each centimeter is 1 point. And we track how clients are doing in each of these different life areas from session to session. So the little script here, it says, looking back over the last week, including today, help us understand how you've been feeling by rating how well you've been doing in the following areas of your life. Where marks to the left represent low levels and marks to the right indicate high levels. And you can fill this out for another person also. So how you think he or she is doing. So if you have a collateral in session, which a lot of times when we're working with, addiction clients, substance abuse clients, mandated clients, we want to get the perspective of the collateral. So we could have the collateral fill this out as well on how they feel that the client is doing. And also a client can put where they're at with one color pen, and where they think that their spouse, or where they think that their parent, or where they think that their child, or where they think that their probation officer would rate things for them on how they're doing. So if we have introduced the reasoning for the outcome rating scale, we are going to get into the introduction of the scale itself and say something like this. I'm going to ask some questions about 4 different life areas, including your individual, interpersonal, and social functioning. And there's also a different script on the handout that I attached with the scales. Underneath the ORS, there's an oral scripting for the oral version of ORS. That's similar to this, but it's different. I adapted the way that I typically introduce it. So each of these questions is based on a 0 to 10 scale, with 0 being the worst that things could possibly be and 10 being the best that things could possibly be. Thinking back over the last week or since our last conversation. So at intake, you're going to say recently or within the last week, or, how things are today. And then at the next session, you're going to say since the last session, since the previous session, how have you been doing? How would you rate how you've been doing individually with your personal well-being? How would you rate how things have been going for you interpersonally with your family and close relationships? How would you rate how things have been going for you socially with work, school, and friendships? And then how would you rate how things have been going for you overall with your general sense of well-being? So there are some clarifications on some of the dimensions here with the different life areas. So individually, if a client asks for clarification, what do you mean exactly by individually? You just say something like you yourself, you as an individual, your personal functioning, just you on your own. Interpersonally, if they ask, what do you mean exactly by that? You just say like in your family, in your close relationships, parents, siblings, spouse, partner. Socially, if they ask, what do you exactly mean by that? Your life outside the home or in your community, work, school, church. And then for any of the scales, if the client gives you 2 numbers, you can ask, which number would you like me to put? That's sort of like if you're asking on a 0 to 10, or is it closer to X or Y? Is it closer to 6? Is it closer to 7? Or you can average them out. So it's 6.5, 6.5. So let's try how we might introduce the outcome rating scale to clients. And again, you can use whatever you want from the script here or the script that's on the handout that I sent. But can we give it a shot here?
Okay, so just to make sure I'm following, are you saying that for the clinician to be able to introduce life areas and how it's going to be rated?
Yeah, so how would you introduce this to a client once you've sort of given the justification for why the actual scale itself? So when you're showing them the scale and explaining to them, how to rate it or what,
Oh, I see that. Okay. All right. So I guess after it's been introduced in the justification, I would say, okay, so now we're going to use what we call an outcome rating scale. I'll explain it to you so that way we're all on the same page. And it's basically in the system, what we're doing is we're going to rate on a scale of 0 to 10 particular life areas. We can, you know, there's an individual, there's interpersonal, social, overall. And, you know, in case you have any questions about individual, it would be basically about your progress, about how you've been doing in terms of the services we've been provided. If you put a 0, then that gives me an idea that maybe we're not doing so well. And if you put a 10, that gives me an idea that we're doing very well. And anywhere in between can give us an understanding of how the progress is going, and then we can build from there. And you know, it's simple as that.
Mm-hmm. Great. Yeah. And that's what I, you know, usually say as far as the, you know, maybe things aren't going so great, or maybe they're going really well, maybe somewhere in the middle. And, you know, a lot of times when people walk through the door in therapy, it's not, you know, at a 10 usually, but you never know. So, but so yeah, that's great. And I guess part of this is also depending on the context again. So some of us are providing telehealth. Anybody that's mostly doing telehealth? Video and or phone sessions?
I'm doing a lot of telehealth, but I would say 95%. Yep.
Okay, yeah. So I'm like, for me, it's like 2/3. So yeah, a lot of times I'm using the numbers rather than the actual paper scale. So I'm asking, you know, on the 0 to 10, getting the numbers rather than having them actually fill out the scale on paper and then calculating the numbers later. But so yeah, getting the idea of the 0 to 10 continuum, and just making sure that they're familiar with the different dimensions, the different life areas. So it kind of helps to compartmentalize, not compartmentalize, but just sort of to put things into different categories as far as areas of life. So yeah, on my own, you know, I'm doing pretty well, but just when I get around my family, things just kind of, you know, they dip. Or at work's been really stressful lately, and, you know, stuff like that, or school's been, you know, so, but then overall, generally, you know, I've been managing. So, you know, it's not as bad as, you know, as I may have thought, or, you know, that I think. So, getting them familiar with these different life areas and dimensions is helpful therapeutically, but also, you know, as far as tracking the progress. Any other volunteers as far as how they might introduce the scale itself, either with the paper or via telehealth if you're on a video call, or a phone session?
I don't know exactly how I'd phrase it, but a couple of things that are coming to mind that I would want to include are that there's not a wrong answer to it. You know, just answer the way that feels the most accurate to you, and kind of stress the importance of being honest about it, because if we're going to do real work together, then it is important to know, like, okay, where are you at this point in time? And kind of describe it as like, you know, if we're looking at scaling this, like, where are you personally at, like in a snapshot, give me a number on a scale of 1 to 10. Or if, you know, if it's an adolescent or somebody who's used to grades, like, give it a grade. Right.
Yeah, absolutely. So yeah, being honest, no wrong answer. I love those ideas, and that's definitely what we want to be conveying to our clients is, you know, it's okay wherever you're at, you know, and we're meeting them where they're at. So. And, you know, a lot of times I preface it in at the first session with, you know, we can get, I definitely want to get more details, and I want you to elaborate on these scores. But at first, I just want to get a baseline of scores so that we know where we're starting at. And then you can tell me a little bit more about, you know, why you rated things the way that you rated them as we move along here. So after I get the numbers, then we, you know, talk more about that. So
I think the only thing that I would add is that I would encourage the client to also track their own progress as I'm tracking it, so that, you know, we're both seeing it together. And that when it fluctuates, we can talk about what happened during your week that it fluctuated, because it was, we had gotten up to an 8 and now we're back to a 6. And so that they can start to look at how they're not using some of their coping mechanisms, or how certain things have caused them to be a certain way. And then that could help to empower them so that they'll be able to have an additional tool. So that's the only other piece of it.
Absolutely, definitely. Yeah, it helps to encourage the client to be mindful and aware, self-aware. So, you know, be conscious of, you know, what's happening and their progress or lack thereof, and what's been going on, what, you know, may have been impacting the progress and lack thereof. So it's a very good point. Okay, so some ORS follow-up questions to invite therapeutic conversation and dialogue would be things like, and again, they're just open-ended, kind of like, can you tell me more about why you rated things the way you did? Can you tell me about what has been better since last session? And or what's been better since you started therapy? Or what are some things that could happen that would lead to higher ratings in this area individually, or, you know, interpersonally, socially? You know, what are some things that could happen that would lead to higher ratings? And then what would things look like we were talking about, like Lewis was talking about, as far as what would things look like at a higher rating in this area? Can you paint me a picture, an image of this? What's the vision? You know, so we create a clinical vision about where things are at, or what things will look like, you know, when we're moving more towards our goals, and or when we've reached our goals. So any thoughts about any other adaptations as far as questions to follow up with after we've gotten the ratings, after we've gotten the scores, after they've filled out the scales?
I'm wondering, and maybe I'm wondering if this would be helpful. You know, sometimes when we talk about rating scales, if the person gives us a high number, right, we'd be like, oh, that's good that you gave us this number. How can we bump it up to the next number? Would it be useful to talk about, so let's talk about why you didn't choose a lesser number? Maybe that can identify some strengths and things like that.
Absolutely. Yep. Yeah. So what's been better since last time? Or, you know, how did you get up to an 8 in this area? Wow. This, you know, this is the first time I think that you've, you know, rated this highly, or, you know, had things ever been down at like a 4 or 5? And what did that look like? And how did you get to the 8 from the 5 or the 4? And yeah, wonderful. Yep.
Lewis, I was thinking similarly, but I love the question of, like, you know, the statement, paint me a picture of that. Let me see it, let me hear it, let me smell it, let me feel it. I think whenever you can incorporate the senses in to anything that creates like more meaningful learning in the brain.
Mhm.
But also I love that comparison. Like, okay, so this is what you imagine a 10 to be. How is that different from the 5 that you're at right now? So kind of like that same thing that Lewis mentioned. What are the differences?
And that the problem entirely solved or whatever it is or whatnot that Lewis had referred to earlier, you can determine whether this client is probably going to be more like an abstinence model client or like a harm reduction model client. When they say like, oh, I'll definitely have cut down, like I've been stopped drinking and driving, or like I'll just spend certain amount of money or whatever, different things like that. You can see whether you want to approach this client with more of an abstinence model or harm reduction. So they say, well, I will have totally stopped gambling. I will have self-excluded myself from the casinos, signed out of the casinos, cut off, gambling buddies. I mean, whatever it may be. So, so the justification for the session rating scale at intake is at the end of the session, at the first session. And so I always leave 5-10 minutes at the end. And so at intake, I say, I want you to know that I value open and honest feedback, input, and constructive criticism, good, bad, or indifferent. I'm very interested in hearing about what your experience has been like during our sessions and what you've been getting out of therapy. I want to try to make sure that you're feeling heard, understood, and respected. We're working on and talking about what you want to work on and talk about. And my approach is a good fit for you, and that overall each session is right for you, helpful, useful, beneficial. So at the end of each session, I'll be administering this scale called the session rating scale to see how things went. I would appreciate you being as open and honest as you can when we do it. And so there's that openness and that honesty that Rachel was referring to earlier. So for those of us who were not here last week, this is the session rating scale. And again, it's like a 0 to 10 continuum line. And 10 centimeters. So I felt heard, understood, and respected, not so much. We worked on and talked about what I wanted to work on and talk about, or not as much. The therapist's approach is a good fit for me, or not as much. And then overall today's session was right for me, or maybe there was something missing from the session. So the clarifications when it comes to the dimensions of the SRS are for goals and topics. If they want clarification, you say, something like, did we talk about what you wanted to talk about or address? How well on the scale from 0 to 10? And then again, for any of the scales, if you're doing telehealth and you're getting just the numbers, and they give you 2 different numbers, which one would you like me to put? Is it closer to X or Y? You can average them out. Maybe they say, well, I felt heard, but I don't know how much I felt understood. Okay. How much did you feel understood on the 0 to 10? Because that's going to be the lower one. So we'll go with the lower. And the same with the ORS if they have one thing with the work and one thing with school under the social, dimension, they say, well, with work, it'd probably be like a 3, but school would probably be like a 7. So you could average those out, give it a 5, but concentrate on the 3 in the session and figure out, what needs to happen for things to be better at work for them. And then also you could talk more about what's been going well at school. But so any thoughts about how they might introduce the session rating scale at intake to their clients? Louis, you mentioned before, sort of, what, how you explained it. And I thought that was a, great explanation. Any other thoughts about things that they might incorporate into their explanations of their explanation of the scale and the culture of feedback that we're going to be trying to create?
I often will work with a lot of clients and use other types of scales. And so, this could be something where I can say, I want to be able to adjust our direction if we ever need to.
Yeah.
If we recognize maybe we're hit a roadblock or
Right.
something like that, this is another way for us to kind of determine how things are going and if we need to make any kind of changes for you as the client and for me as the therapist.
Absolutely. Yep. Yeah. It's sort of it helps create a roadmap, and we start to understand what's helpful to them, what's most helpful to them, and how, and what am I doing that, is helpful, or what do I do that may not be so helpful? So. And then adjusting accordingly. Thank you. So as far as once I've introduced the justification for why I use the SRS, at the first session, I say, I'm going to ask some questions about our session today, including how well you felt understood, the degree to which we focused on what you wanted to talk about, and whether our work together was a good fit. Each of the questions are based on a 0 to 10 scale, like the other scale, with 0 being the worst that things could possibly be and 10 being the best that things could possibly be. And thinking back over our conversation, to what degree did you feel heard, understood, and respected? So that's the relationship dimension. To what degree did we work on and talk about what you wanted to work on and talk about on the 0 to 10 goals and topics dimension? How well did my approach or method fit for you? And that's the approach or method dimension. And then how would you rate how things were in today's session overall? And that's the overall dimension. And then clarifications on the SRS. We talked about that. So any other thoughts about how we might introduce the actual scale after we've given the justification for it?
So just to make sure I'm following, is the idea to ask once they give the score or before they give the score?
Before.
Before, how to introduce what the number is going to be. Okay.
Mm-hmm.
I sort of hear all the examples that were given. It sort of like ties in at a different degree and things like that. So maybe, if we're introducing the session rating scale to an individual, I probably would say something like, hey, all right, so we just finished our session. I want to take a few moments just to talk about how everything went. As we mentioned earlier, your feedback is important. Your progress is important. On a scale of 0 to 10, I want you to let me know what was the overall outcome. How did you feel overall in terms of the session? I want to incorporate with some of the, like Rachel mentioned, there's no right or wrong answer. The goal here is to help. The goal here is to move forward, and whatever number you give us, we're going to work with that.
Great. Yeah. Don't worry about hurting my feelings.
Exactly.
How often have you heard that from a therapist? I don't know if any of us have been to therapy, but it's not often that, don't worry about hurting my feelings. It brings you down to earth. It brings you, it's humbling. It's humility. They like to see that. They like to see that, like you're open to, feedback, because there is a clinical cutoff of 9 for each of these. So basically, most of the time, clients are going to rate things highly because of wanting to please the therapist. That's just human nature. But so we want to get justification from them about the scores afterwards, so that we actually get, some qualitative input, not just the quantitative. And it's not the worst thing to have a hash mark down here. This means that they feel comfortable enough with you to let you know that they didn't feel completely heard, understood, respected. And then you can open up that dialogue and get some, input as far as that. What was it that, was there something that could have gone better as far as that goes? Or goals and topics. Was there something that you wanted to talk about that we didn't get to? What was, what is...
You're doing this at the end of the session.
Yes.
What happens if it's mostly negative? You would want to address it right then, but you might have a meeting or another patient waiting.
Right. Well, that's why I set aside time at the end of the session to discuss the responses and, get an idea of where things are at for them with their experience, and then what I can do to correct things or improve things or make things better moving forward. Is there anything that I could do that would be helpful to make our sessions more productive, to make you feel more heard, understood, respected? At the beginning of the session, would it help if I ask you, do you have like certain goals and topics that you wanted to work on today? Did you maybe come with a little list or something like that, that we can, make sure that we get to these? Or, what is it about my approach that is a good fit for you? Or, is it not meshing right? And, is there something that I can do differently? If not, sometimes this will reveal that, maybe a referral to another clinician might be in the best interest of the client, because we don't necessarily connect with 100% of our clinicians when we're clients, but this allows us to actually, sort of delve a bit into that. Because a lot of times clients just kind of drop off the face of the earth because they just don't go back and stuff like that. But you can repair either a breached relationship, or you can improve a relationship that's not at the top, at the top level from the beginning. So, Any other thoughts about how they might incorporate the session rating scale or the introductions and things that they might say or talk about, besides the honesty, the no wrong answer, the communication, those kinds of things? Sorry, we're running a little over time here, but I will try to wrap it up. So some SRS follow-up questions to invite therapeutic conversation and dialogue. Can you tell me about how the session was for you today? So just an open-ended question. You know, what was your experience like during the session today? I think, you know, Louis, you had basically, you know, mentioned that kind of a question, you know, just very open-ended. You know, how did you know, or how could you tell that I was hearing you, understanding you, respecting you? How did you know that? You know, was it something I was doing, or, you know, you could just feel it, or, you know, so this helps to let you know what you're doing right, what's, you know, what's helpful to them, what they like, client preference, you know, what do you think it is about my approach or method that is a good fit for you? You know, what do you like about my approach? What do you like about my method? Any other follow-up questions that that those of us might use when it comes to after getting the ratings, after getting the scores? Whether they be high or low or somewhere in the middle.
I mean, I think all the questions are excellent, actually. They cover a lot of ground. I mean, would it be okay to ask something like, to ask a question along the lines of, all right, is there anything else that maybe we can talk about that hasn't been talked about yet in this particular life right here?
Mm-hmm. Yeah.
Mine's not a question, but just like a general thank you for their feedback, and just being really genuine about that, no matter what scores they gave you. You know, being equally as appreciative, or maybe even more appreciative, if the scores were lower than if they were, you know, really high across the board. Because
Yep.
I think it's good for clients to know that, like, yeah, you're like learning and growing and doing a lot here too, but like I can take some things from you as well.
Mm-hmm.
I think
Yeah. And I've, you know, definitely adjusted my practice based on, you know, the feedback that I've gotten, the input that I've gotten, good, bad, or indifferent. And things like, well, you know, it'd be helpful if you could give me more suggestions. Like, I'm looking for more like coping mechanisms. I'm looking for more like tools. You know, you listened really well, but at the same time, you know, I was looking for a little bit more input from you. Or, you know, you'll hear these kinds of, you know, when the client opens up, these are the kinds of things that you'll hear. And you may not be used to hearing these things because, you know, maybe we haven't just really deliberately opened up that dialogue. So sometimes we have to be kind of deliberate with it. So what we can do with the data is, with the paper scales, measure the scores with the 10-centimeter ruler on the 0 to 10 again, calculate the score for each individual area out of 10, and then the total scores out of 40. The clinical cutoff for adults, which means that when most people enter therapy, they'll be at 25 or lower. Adolescents, when they enter therapy, they'll be at, usually, the clinical cutoff is 28. So in most cases, they'll be at a 28 or lower. Children, school age, they'll usually be at a 32 or lower. And then caretakers for children would normally be at a 28 or lower also. And one thing that is suggested is if you have a total score of 10 or less, definitely do some, questions about lethality, which you're probably normally doing anyways, but definitely risk assessment, time and stuff like that. Do you have hope? Do you have, things that you're looking forward to? Do you have a purpose in life? Is there meaning to your life, or do you have supports and all the things that we would normally do as far as that goes? With a web-based outcome tracking and reporting system, which we'll be talking about next week, My Outcomes is one of them. Maintain scores for each client you're working with and periodically check your provider statistics to determine your effectiveness, which we're going to get into next Monday. So in the interest of being feedback informed, I don't have an easy way, I guess. Are there ways that people can direct message in Zoom? I'm really like a tech, not a tech savvy guy.
You can click on the 2 in the chat box and then just send it directly to Adam, so you're not sending it to the full group.
Okay, so yes, if you
Adam,
would.
just so you know, we've lost about half our group because
I know it's over. I'm way over, so I apologize for that. But yeah, for those of us remaining, if you could, I would appreciate in being as honest as possible, and any qualitative feedback that you have, you could either direct message, or this is going to be the time now to share. But so how engaging was the training today? How informative was it? How clearly was the information presented? How useful, helpful, beneficial was it? And how likely are we to utilize it, what we've learned? So again, you can direct message these responses to these quantitatively and qualitatively. And then any thoughts, input, feedback, constructive criticism, good, bad, or indifferent about the training today.
I don't mind saying this out loud if that's okay. I just
Yeah.
wanted to thank you for this. I'm always looking for ways to check in with my clients to see how they think things are going. One big thing that I really hold close as a therapist is that the relationship that the client and I have is just as important as the work that they're doing, because they're relying on me to help guide them and go along that journey with them. And so hearing from them how they feel things are going, and maybe our interventions and being able to provide feedback, it's so important. So this is great to have like a structured way to be able to do that. So I appreciate you sharing all of this.
Absolutely. And that is one of the main indicators of a positive experience in therapy, is the relationship, the quality of the relationship between the client and the clinician. And when we talk about common factors, that contributes to a huge portion of what's effective in therapy, is having an alliance with your client, having a therapeutic relationship that's open, honest, and it's comfortable for the client. So you said the magic word, and that's relationship. That's what this is, all about. So any other thoughts, questions, comments, concerns, problems, issues?
Not doing it on paper, but the first 3 were a 10 and the last 2 were 8s.
First 3 were 10 and the last 2
Were 8s.
8?
Mm-hmm.
Okay. Can you tell me a little bit more about any of those ratings?
I do something similar. They gave me some new ideas on some things to incorporate. I do a lot of DBT, so I use diary cards a lot, and I'll add some of the questions to the diary cards.
Wonderful. Okay, thank you. Anything else? Sorry, I know we're like.
I know,
over.
Louis, I have to turn this off.
Well, thank you everybody for your time, attention, and
Sorry, Louis.
participation, and